Jennie Joseph presents The Hands That Caught Us, a legacy podcast series with our midwife elders, an archival offering through the Perinatal Pause Podcast with Jennie Joseph, where we rest, reclaim, and remember one story at a time. Welcome to The Hands That Caught Us, a sacred series within the Perinatal Pause Podcast with Jennie Joseph. In each episode, we sit in reverence with our elder midwives, keepers of ancestral knowledge, community healers, and witnesses to the sacred continuum of life. These conversations are a pause, a restoration, and a reclaiming of our birthright. These are the stories that built us, and these are the stories that sustain us.
Well, here I am with the wonderful Mama Elder Midwife Martha. Martha, thank you for joining us today.
Yes, you're welcome. You're welcome.
It's just such an honor to have you on, and I'm so excited and looking forward to hearing what you have to share with us. You've been a midwife for how many years is it now?
Well, actually, this month I've had my certification 30 years. So August 1995, that's when I
Major
got my
congrats.
certification, or technically I started working, but my certification came through in September. So we're right at, I think it was September 9th. So we're right at 30 years.
How amazing is that? Could you
Yes.
imagine how many babies you caught? Have you got any sort of numbers in your head?
I think kind of roughly about 900 to 1,000.
Yeah.
Mhm.
Wow. Well, as I've been speaking with the other elder midwives, and, we midwives, we have our ways of explaining how we got called, how we landed here. Can you take us back to, like, what was the very first thing, the first instant when you knew, or the first time you experienced it? How did this midwife Martha show up?
Well, it actually started when I was in the 11th grade,
Oh,
and it wasn't with seeing a birth or anything about someone pregnant, but I was in study hall in high school. And of course, our study hall was the library. And so when I'd get done with my homework, I'd get up and look through the different stacks of books. And I just happened to see this book said Frontier Nursing Service. So
oh,
I said, wow, what is this? And, I kind of like books that were not very common, or topics that weren't necessarily common. So any type of book, any topic that seemed a little unusual or that I hadn't heard of. So I saw this book that said Frontier Nursing Service. And I thought, what is this? And it was actually the story of the site for the first nurse midwives in America in Kentucky. And Mary Breckinridge brought the midwives from England, and she felt like midwifery from England would fit more in the US, especially in her state in Kentucky. And she liked that public health model that they had in England. Now, her father had been a diplomat in Russia, and she'd also done some things during World War I in France. And she saw those midwives. She just felt like the British model was the best. So they had a motto that said, if someone could get to us and tell us that a woman needed our help, we would figure out a way to get to them. So I kind of like that, and that kind of stuck with me. And each midwife in Kentucky, they had a horse, and actually even their uniforms were the English riding gear. So the tall boots and, almost what you think about what they ride, national velvet or the dressage uniform. And they also had canoes because it would rain and flood a lot. So they came in about the early, I think it was in 1923, they came to Kentucky. And within just a short amount of time, they lowered the infant and maternal mortality rate in that area, which of course is a lot of poverty and all. And I thought, wow, this is fascinating. So I went and I was telling my mom, which my mom's a nurse, and I said, wow, I want to be a nurse midwife. And she looked at me and she said, they don't use those kind of people anymore. And my mom was always positive. I did a lot of things and traveled, and they never said, oh, you can't do this, you can't do that. So I was also interested in political science. And I ended up getting a degree in that and then going to school in Israel, graduate school, because at that time I wanted to work for the States Department. But when I came back from there, I said, you know what? I still want to be a midwife. I don't know. It was something about, not that I met midwives there, although they use predominantly midwives in Israel,
Mm-hmm.
but I said, I still think about that. So I found a program, accelerated nursing, and I got my degree in nursing. And I purposely went to a school that had a midwifery program, St. Louis
Mm-hmm.
University. And a lot of the top midwives at that time that were even writing the textbooks in midwifery in the US, they had gone to that program. So when I got done with my bachelor's, I decided to look into that program, and they said they weren't enrolling any new students because of lack of clinical sites, which has always been, an issue with midwifery,
Still is.
because it's
Mm-hmm.
just about a one-on-one type of education, or your clinicals one-on-one. And then in St. Louis, where the school was, we have two large medical schools, St. Louis U and Washington U. And of course, he was also competing with those med students and residents to get your number of births. So since I was there already, I decided to study psychiatric nursing, and I got my master's in that and was a
Mm-hmm.
clinical nurse specialist. And then I started telling my patients in therapy, follow your dream. And I thought, wow, I'm not following mine. So 10 years later, I found a program, and it ended up being Frontier, which is, of course, the story of where I read that book in high school.
Mm-hmm.
And I went through their program and finished that. So I went full circle
You
from
did.
that school, from that book I read in the 11th grade to going to that particular program. And of course, at that time, when I decided to first start study midwifery in 91, or actually I started the program in 92, but I started looking into it in 91. And at that time, of course, there were a lot of nurse midwives in the US. Well, I won't say a lot, but a significant number, maybe like about, 8 to 10,000. Um, and in this magazine, the Journal of Midwifery, they had that there was at that time only 31 African American midwives that belonged to American College of Midwifery. And I thought, what? 31? It has to be more than that. So I think maybe there were some people that were midwives that they
Mm-hmm.
didn't belong. But on the other hand, there weren't that many even midwives of, the majority race, white race. And it was even difficult for them because so many states wouldn't allow practice,
Yeah.
hospitals wouldn't allow practice. Pretty much the ones that even went through that program I went through prior to me starting that program, they would just work in clinics or even
Mm-hmm.
teach maternal child nursing. So,
Yes.
it's always been up and down, up and down.
Yeah. I
So
mean,
I thought, wow, there's not even that many of us. So I felt really honored that I was able to get into that program. And
and again, which university was it, Martha, that you were there?
well,
Studying?
it was Frontier School of Midwifery and Family Nursing
Okay.
in Hyden, Kentucky.
And
And
the
they had
title?
actually they had the first nurse midwifery program in the US,
Mm-hmm.
and the site of the first nurse midwives that came. Now, the reason they opened the school before that, all the midwives in Kentucky, they were educated in England. So
Yes.
even if you were American and you wanted to study midwifery, come back to a state where you could work, you actually went to England. So
Right.
they
Right.
did start a program, and during World War II, all those midwives that were from England, they were called back, during the war years.
Yes.
So that really pushed them to start, an actual program here in the States. But yeah, now it's called Frontier University. So if people
Right.
want to look that up, it's now Frontier University. And not only can you study to be a nurse midwife, and you can be a family nurse practitioner, psych nurse practitioner, and
Mhm.
women's health. I know
Yes.
they have all of those routes of care. And the midwives that were in Kentucky initially, when they had the School of Midwifery and Family Nursing, was again, they wanted to mimic the British model of
Yes.
integrating it into public health system. So with the home births, and anyone that's watched that show called The Midwife, you'll
Right.
see that, yes, they focus on pregnant women and the deliveries, but they might also have an older gentleman that needs a dressing change, or something's
Yes.
going on with someone else that's not pregnant, or some other family member. So um, I almost wish we had that model of care in the US, because you could really integrate a lot of care into for all people, um
Yeah.
and get them into the system. It's hard getting people into the system.
The American system is so unique in so many ways. I mean,
Mhm.
what a very important piece of history that you've shared with us right there. So many folk don't recognize, literally, like you said, the full circleness of midwifery in the United States. I
Mhm.
mean, if you think about it, from enslavement onwards, it was the
Mhm.
African midwives, the Black midwives who delivered the majority of folk.
Right.
Through the Jim Crow era, they
Mhm.
continued to deliver. Black midwives, particularly in the South of the United States, delivered the majority of people, Black and white. And, yet somewhat invisibilized, right? And then, of
Right.
course, erased altogether on purpose, right?
Right. Right.
So that we then grew into a system of obstetricians being the main provider. And this is still the unique position that America holds to this day.
Right. Right.
90% of pregnancies and births managed by OB physicians,
Mhm.
specialists in every other country.
Mhm.
This is one country where a specialty is the majority provider. And
Right.
yet, all these years later, all these different circles that we have been in, you're right when you say, midwives tended to community, right?
Mhm.
The
Right.
model that essentially was imported from the United Kingdom in the
Mhm.
1920s that became the frontier
Right.
nursing service was that model that said we tend to community.
Right.
Call
Right.
the
Right.
midwife. It was a
Mhm.
community, as is
Right.
still a community endeavor.
Mhm.
Across this globe, the communities choose their midwives, and their
Right.
midwives respond to those communities. And yet
Mhm.
here we continue to struggle. Midwifery is by no means mainstream. It's
Mhm.
I mean, it's unlikely that you'll meet, every person you ask a question about a midwife, that you'll meet folk who say, oh, I know exactly what that is. I know exactly how it works. I know all the things I need to know, and I know how to access that as well. No,
Right. Right.
2025, and we're still in that dilemma of having people say, what's that? Oh my gosh.
Right. Right.
And
Right.
so it was interesting to hear your mom's response. As a
Yeah,
nurse,
but they don't use people like that anymore.
that's right.
Although, it could have been because that was like in 1969, 68, kind of in that
Yes,
time.
yes,
Of course, they were still being used in the South. It was kind of maybe not as frequent. My mom is actually from New Orleans,
uh-huh,
and so I don't know if being in New Orleans, I don't know how many midwives were, but certainly you get out in those rural areas, and
yes,
it's just like I'll speak to someone and I'll say, "Oh, well, where were you born?" And if I know their age, I'll say, "Oh, so a midwife delivered you."
right. And
But
they
you just know that's the way, especially if they're African American.
Well,
Um,
what's interesting too is, I've spoken to some of the other elder midwives doing this series of podcasting, and
mm,
many times we, start exploring, well, were there midwives in your ancestral line? Who's in your family? Were there the carers? Your mother was a nurse, right?
Right.
This
Right.
is something that brings this, when the calling hits us, it's strong. It's not even a matter of like, maybe I should do something else. Seems like you
Mhm.
tried a couple of other things, but you kept coming back
Yes, yes,
to
yes, yes.
midwifery, right?
Right,
Do you
right.
know in your family history, is there any
Well,
knowledge
no,
of midwifery?
actually, I didn't find out until I finished school that my great grandmother, who I was named after, Martha, that she was a midwife
Right
and an
there.
herbalist. And no one had ever talked about that.
Right,
No
right?
one had ever spoken about it.
This is
So
when
I just
midwifery was
found that out.
normal.
Yeah,
Hmm.
I just found that out since I've been a midwife.
How did you feel
Yeah.
about that?
Well, I wish I had known that before, although I'm glad I found it out. I,
Yes,
I knew that she knew a lot about herbs, but
yes.
I didn't know that. But then that makes sense because um, she she was born, actually, I thought she was born in slavery,
Hmm.
but she was born about 6 months after slavery was over, but
Hmm.
they were still on the plantation.
That's right.
Um, she moved from Georgia to Illinois after she got married, and they were on a plantation. Um, and they moved to Southern Illinois, and of course, I don't think it was too many doctors there, or Black doctors.
Right.
Every now and then you could be in some towns or regions, maybe where a white doctor might help you. But probably it was just midwives and other women helping other women
That's
because it
right.
just wasn't even that many physicians. And as you know, a lot of places, even if there were even Black physicians, sometimes people couldn't afford it.
Right.
So,
This is that full circle piece again.
mhm,
We look at where and how, Black people, immigrant folk, indigenous folk,
mhm,
they
mhm,
had their midwives.
right.
And they continued to use their midwives, especially as they were, for the most part, prevented from
Mhm,
entering what became mainstream, were prevented from accessing hospitals. I think when Black people were, eventually let in, so to
mhm.
say, they were let in through the back door or through the basement, right?
Right, right, right.
Segregation went right on up into the 60s. I mean, thinking about each decade,
Mhm,
through the 20th century, from the early 20th century, where the Shepherd Towner Act and the laws and rules that changed how the grand midwives, so-called granny midwives,
mhm.
were basically just removed and eradicated. And through that era, there was nothing that really replaced that, right?
Right, right,
As
right.
nurse midwifery grew and became, more acceptable, and it came through the nursing route. And of course, it was, obviously then linked more to the institutions. The
Mhm, mhm.
community lost their community
Right,
midwives.
right, right. Well, yes, and then speaking of the basement, I was born in the basement of a hospital in Illinois, and it wasn't because my family couldn't afford it. Luckily, my grandparents, my dad was kind of superintendent of or my grandfather was superintendent of the Black schools in that town. My
Mm,
grandmother was a teacher. My dad and mom had finished Tuskegee, so we really weren't we were kind of looked up to in that town because everybody knew Professor Lewis is what they called my grandfather.
yes.
So, but it was at a Catholic hospital, and so everybody Black had to be in the basement. That my dad had even gotten my mom some roses when I was born, and they put it on a chest that was very close to the pipes. So of course they quickly died because it was too hot. And then my dad had brought my mom some magazines to read. The nuns took the magazines from her, and I won't say gave it to any of the white people. I don't know who they gave it to, but they removed them.
Yes.
So, you have to know that you're on a lower level. Now, this past summer, I had lunch with the woman whose dad delivered me, Dr. Davis. He had gone to Howard, and then he went to Meharry Medical School. So I'll be 74 this year, so that was a long time ago. But I found out from her that even she and her brother were born in that basement. So it had, and her dad even worked at that hospital doing deliveries. Well, he was general practice, you know.
Right, right.
Oh, he took care of everything. And then we had another Black doctor in town. He was a surgeon, and his wife had all her kids in the basement. So it had nothing to do with where
Yes,
you were on some kind of hierarchy that, you know, so everybody got that care. But, you know, that was how things were, where if you
yes,
could go to a white hospital, but you always had to be shown that you weren't quite on the same level. So you
indeed.
could be in that hospital, but you had to be in a different bed or in a basement
Mhm,
or
mhm.
or something such as that.
Yeah,
But
I've heard these stories of, the colored wards and the segregation went all the way. And
mhm,
so, we look at what we're dealing with today and these racial disparities, these poor outcomes across, racial lines that we can see clearly is not
mhm,
physiology. This
mhm,
is these continued structural ways of being, these harms that are baked into our systems
mhm, mhm.
that have been so detrimental that
Right.
we, as the world's most developed, most resourced country, developed into the point of like billions of dollars changing hands in healthcare. And
Mhm, mhm.
these results stand. We are dead last and we remain so. And in fact, it's worsening. And, midwifery can't save us, not in America, right?
Right,
Because
right.
we have never been able to move into any kind of scale, right?
No, 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 no,
And so
not at
when we
all.
this I mean you would know, especially working in the from the the process that you have been through and the trajectory that you have been on, where you have established a following, you have established a practice and a clientele that know how to access you, have
Mm.
been faithful to you, have been able to stand with you. And we would hope that things had moved so much further that there's not just one Martha here and one, somebody else there. And
But
how
it's still like
happened?
that. It's still like that. And you know, actually, I haven't done deliveries for a few years because I was so frustrated with how I was treated and how my patients were treated at the hospital.
Hmm.
And then, you know, I felt like I was being harassed. And so I quit going there. But then it wasn't within 6 months of me not being at that hospital that they got rid of all the midwives. They even had the midwifery service that the School of Medicine, that it was called University Medical Center, that
Hmm.
the School of Medicine had hired, and they had a group that saw the School of Medicine patients. And then they said, oh, we're not going to have midwives. So what happens is that either doctors or someone in the hospital or
Hmm.
someone, I don't know if it's insurance companies or who calls the shots on that, but you'll get like some midwives for a while and everything will be rolling along, and then all of a sudden, well, we don't, you know, we don't want midwives here or whatever. It's something. So then everything rolls downhill again, and
Right.
then they gradually go up, and then they
Hmm.
roll back down. So there now in this state, I would say we probably, well, now we have a number of nurse midwives that's been hired by a large group that has multiple offices. But so many of the women decide to do home birth with direct entry midwives, and that actually works out better for them. So I've even had some midwives say, "Oh, can you help us get into the laws on the books in the
Yes,
state, and we want to get licensed." And you know, there's a plus to being licensed, but also you're controlled.
that's right.
So right now, the laws in in the state of Nevada is they're silent on midwifery. So within themselves, most people kind of say, well, you know, you should be licensed or be a CPM or go to school or do something. Some people do an apprentice model,
Mm-hmm.
but certainly they really have a lot more to do with midwifery care and birth than nurse midwives because
Well, and
everything's up and down.
mhm. I think
Mhm,
you bring up a good point because state by state, that's another conundrum for
mhm,
America. Each
mhm,
state has a different way of being, different set of rules and laws, different
mhm,
midwives. We know that nurse midwives, of course, across the entire country are eligible for practice and are typically employed to do work inside of hospitals,
mhm,
institutions, like you
mhm,
said,
mhm.
education, clinics, health centers, etc., some private practice. But again, this other midwifery route, professional midwifery route, is through
Mhm,
certifying as a professional midwife
mhm,
or as a
mhm,
direct entry midwife.
mhm,
Um, DEM, sometimes called is one of the acronyms. Um, but then there are these traditional midwives also who
mhm, mhm.
contribute a really important piece because if we go
Mhm,
back to that original understanding of midwifery and the global understanding of midwifery,
mhm.
again, we have to accept and acknowledge that it's for and with the community. And
Right.
so you're right, the midwives that have the greatest access to the community, the traditional midwives, the
Mhm,
empirical midwives. I mean,
mhm.
you think about it, your grandmother, her midwifery skill set was handed to her somehow,
Right,
handed
right,
down,
right, right.
maybe by enslaved midwives, maybe not, but certainly the art and science of midwifery has
Mhm,
historically and continually been passed from one midwife to another.
mhm, mhm.
And
Yeah,
so,
so, oh, I'm sorry, go ahead.
go ahead.
Yeah, so another thing that changed with had an impact on especially Black midwives was that in 1961, I think was the year, that's when we start getting Medicaid.
Yes,
So now, oh, there's money in those poor women.
that's right.
So then they were moved to the hospital.
Mhm.
So the Black midwives, not only did the nurse midwives kind of squash it because they said, oh, you got to have this certain type of education. You don't really know what you're doing. And and uh and then so that was one thing. Not that the necessarily those nurse midwives were doing home births or even
Mhm.
wanting to take care of those women. You know, poor Black women lived in the rural areas, um, like so many of our other Black midwives. Uh, so they didn't necessarily want to be out there either with in the women's homes or where there maybe wasn't running water or there wasn't like birth kits, you know, so um they wanted to be in the hospital and then probably the doctors because they had to have supervising, probably back then they were supervising, not collaborating physicians.
Mhm.
They
Yes.
told them, you can't be out there doing those births. You got to bring them here in the hospital. Of course, they didn't let them practice that much in the hospital either. So it's just been a total mess. And I think I should, maybe that's not a very professional word to use, mess, but it really
I think
is.
that sums it up.
And it's never, that's the other thing about healthcare in America. It's piecemeal, is not a coordinated healthcare. It's not, they talk about a healthcare system, but technically that's word to me is loosely used. And it's more sick care. There's
Yes.
very little preventative. People have lost a lot of faith in the medical or not so much the midwifery community. That's why they use midwives, especially the CPMs. They haven't
Mhm.
really lost faith in them. And
Mhm.
so I think that's where people are. They want women to respect what their wishes are for their body
Exactly.
and their health care. And this woman, I don't know why I'm forgetting her name because she's on TV almost every night. But she's on CNN and she has a program that, at least out here, it comes on about 7 in the evening. And she did a home birth.
Yeah, you're talking about Abby Phillip.
Albie Phillips, right. She did a home birth, and of course she did
Yeah.
the film, and I saw that special. And of
Yeah,
course she said that she was just fearful to be in the hospital because
that's
of
right.
things that happened to Black women. Of course, they happen to other women, they happen to us more. And it
Yes.
doesn't matter whether we're educated, whether we have money, whether we
Mhm.
have those $1 million, insurance policies. What I mean, look at what so
Serena Williams.
and then, there was a Black, I think now I can't remember what she was. I know they've had Black midwives work at CDC, things regarding education there and maternal child health. But
Mhm.
there was this Black physician that she was studying about the um, maternal mortality rate, and I'm sure you heard about her, and she ended up dying while she was pregnant. So it
Yes,
doesn't matter if you're a doctor, it doesn't matter what your education, what your knowledge base is, you're still vulnerable to this system.
yes, indeed. I think it's most shameful situation for a
Mm-hmm.
country to be in because all of this could be prevented. All of this.
Right.
I look at midwifery around the world. As you know, I was trained in England. I was trained in that British UK model. And when I
Mm-hmm.
came to the United States in 1989, I didn't do any research. I fell in love. I came to get married. I came to live the
Uh-huh.
life. I
Oh,
came
I
to,
didn't realize that. I didn't
yeah.
realize that.
Yeah, I fell in love with an American. And I was like, oh,
Oh,
yes,
okay.
I'm coming back. And I'm gonna,
Okay.
it's gonna be amazing. And, Disney World. And yeah. And so
Mm-hmm.
when I arrived here, I was shocked because everyone laughed and said to me, oh, no, no, we don't use midwives. I mean,
Right,
how can you
right,
not
right.
use midwives if you have babies? Like, what are you saying? And
Uh-huh.
all these years later, Martha, I'll be honest, it's a struggle to this day to
Mhm.
understand how this can stand.
Yeah,
How
yeah.
can this be here? We have research that says where midwives are integrated, the outcomes are better. We have people who, like me, who figure ways as best they can to apply a midwifery model of care to as many
Mm-hmm.
people as they can get it to. We have
Mm-hmm. Mm-hmm.
doulas who are now taking on the midwifery aspect of emotional support and, wraparound support. Midwives have always done that. We will
Mm-hmm.
always do that because that is midwifery, right? And
Right,
so
right, right.
we see all these new ways, the so-called interventions,
Mm-hmm.
trying to get to the solution for this outrageous, persistent maternal morbidity and mortality that plagues us, particularly
Mm-hmm.
people of color. And we throw our hands up and we have another conference and we do some more research and we're like, we don't know. We know.
Mm-hmm.
We know.
Right, 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 right.
There's no confusion here.
Yeah, yeah.
This is simply based on historical and structural ways of being.
Mm-hmm. Mm-hmm.
And just like
And
in
of
your,
making money because,
let's say it.
it's the
Yes.
healthcare business.
Yes.
And of course, after World War II, the British decided that what can we do, what are we going to do for our society, our population? They said, you know what, we're going to have medicine where everybody gets care.
Mhm.
So, that was their focus. And that's why that system works because everything's integrated. The doctors know if, like, for example, if a patient needs a consult with the physician, they can get that consult.
Yes.
If they
Yeah.
need to be transferred or if they need a specialist, that doesn't mean the midwife can't still do their delivery, but
Yes.
they've had some coordination. Uh, so I think one of the reasons I really enjoy that show called The Midwife is because you see that coordination, you see the
Yes, the
respect.
collaboration is in
That
place.
physician,
Mhm.
he respects those midwives just as his colleague, just as if it would be another physician. and he listens to them. And also you notice that they decide to call him if they're having an issue or if
Yeah.
they have a question. It's not like he's double checking on them. So
That
they're
was
in
how
charge.
that's how I was trained. That's how I practiced for 10 years before I came. And, it just boggles the mind that
Mhm,
there could be a situation where that's not available.
mhm, mhm,
Again, in the midst of all these resources, in the midst of all this money,
mhm,
billions of dollars being spent, and here we are.
mhm, mhm,
Let's talk a little bit about the impact on families and community that don't have access to the same type of care that is what you've just described. Like, what do from your perspective, because you've been on the ground all these many years
mhm,
and serviced thousands and thousands of patients along the way, I'm sure,
mhm.
and
Yes.
continued. I mean, you're still
Mhm.
working, right, Martha?
Yes, yes. Now I do now, what I do is primary care for women, GYN, and psychiatry for women. So I integrated my first specialty in. So I do see women just if they have psychiatric issues,
Mm-hmm.
or even I'll get referred people that have maybe bipolar and they're pregnant or other more serious mental health problems. So I see women across the board there. And
What would you say, I mean, when your patients talk to you and share with you, what is it that they've gotten from you that they couldn't get anywhere else? What are they telling you?
you know what? The number one biggest thing that most patients enjoy is being heard.
Yeah.
And I don't care whether you're coming in for a pap smear or you're coming in for whatever reason. Sometimes people just come in and, oh, I just need my checkup and that's it. But, in a year's time or even in 6 months, things happen to people. I spoke to a woman just yesterday. She came in for a checkup. She's 70. She has some, a few health issues, but both her parents have Alzheimer's. Her mother's in hospice with Alzheimer's. Her husband just found out that he has thyroid cancer, so he's going to have surgery next week. She's been having these TIAs, or the mini strokes.
Mm,
Uh, her blood pressure, it's fairly under control. She is quite overweight. And even though she's from the majority group, and she has excellent insurance, she doesn't have people to talk to.
there you go.
So, most of the time the doctors are in and out, or even some nurse practitioners are in and out. Now, I understand why. A lot of it's financial,
Yeah.
because you have a certain amount of expenses, and depending on the insurance, you might get paid $17 for that visit, you might get paid $40, you might get paid $80 for the
Yeah.
same visit, but they have different insurance. So, with the expenses and all, and I don't know about where you are, but we really have a snowballing phenomenon here in Las Vegas of a lot of the doctors are going concierge. So you
Yeah,
have to pay 2 to 3 thousand just to be their patient.
that's
And
right.
usually the people that can afford to do that, they actually don't even need that level of care. I mean, they
Mhm.
go in once or twice a year, but they're not chronically ill where they need to call the doctor all the time or go in all the time. So it's quite, to me, in its elitist type of concept. So, the average person doesn't have that. Or even if they have it, they choose to spend it different ways, but it shouldn't be that they don't get the time. So the biggest um the comment is people want to be heard, and
Yeah,
everybody has a story.
that's
So
right.
I don't know if that story is going to be this long or this long or that long, how long the story is, but there's a story. And what they'll say is they appreciate the most, thanks for listening to me.
Right. And in being heard, I believe you're being healed, right?
Oh,
I think,
yes.
if we go again all the way back, midwifery has always been, the word itself even means with woman, has
Mhm.
always stood in that gap where
Mhm.
maybe no one else at least during the maternity times, has that proximity, has that
Mhm.
intimacy, that has that safety
Mhm.
in being there in that way,
Mhm.
that there's trust that's built,
Mhm.
there's respect, mutual respect,
Mhm. Mhm.
there's dignity.
Mhm.
These are the things that are not measured medically,
Mhm.
but these are the very components, I believe, and I think so many of us do, and we still practice that way, that open up an opportunity where there was none for
Right.
healing.
Right. Yeah.
What gets you up out of your bed every morning to work at 74, Martha?
Well, every day is a different day. And so you don't know when you come in the office what the day is going to be like. And I kind of like that because it's a challenge. Everything's fresh and new.
Mhm.
The other thing is that I I opened my office in January 2nd of 1998. Now, my first job was with the School of Medicine, and actually, I was the first midwife that they hired. So I had a contract with them, and I had a contract for 2 years. So that was over in like about September of 97. I started in August of 95. So I knew like the last maybe year before I got out of contract that I'd like to have my own office because I wanted to do things the way I want to do it. I mean,
That's
nothing
right.
illegal, but I didn't want people telling me, oh, you spend too much time in that room or you're doing this, you're doing that. So, I work within the laws and legality and everything like that. But I didn't want to be controlled.
Yeah,
Now, of course, when that happens, you give up a little bit too because now you got expenses. You got a lease, you got employees to pay, you got to make payroll. You have to have all sorts of licenses. The county assessor assesses you and assesses the furniture in your office. It's a lot to it to run business, but I still felt like I just wanted to be kind of in charge.
there's
So
that
I actually,
autonomy,
huh?
the
The autonomy.
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 Mhm.
But I still have patients, not a lot. I might have just about 5 or 6 that started seeing me in 98.
Yeah,
And they're still seeing me. And of course, I have the girls that I delivered.
that's right.
And so now they're, 25, 26, 27. I also have young women that I started seeing when they were maybe 15 or 16. Some of
Mhm.
them are OBGYNs themselves. One is the dean of a program. Then I have a lot that are attorneys, dentists, one nuclear physicist.
Mhm.
It's just, so seeing the folks and even sometimes just their family, because I might see one sister and then the sister tell me what the other sister's doing or what their
Right.
mom's doing or the grandmother. So I don't have as many as when I first opened the office, but I used to have like 3 generations.
That's right.
Uh, or I'd even have, when I was doing more deliveries, I'd have a woman and maybe 3 or 4 of her sister-in-laws or her cousins. So then you
Mhm.
know a whole family from all kind of perspectives. So now when I go to work, it's almost like I'm seeing family.
That's
I'm
right.
seeing folks and I'm catching up on them. And I say, "Oh, I heard last year you said you were going to go to Ghana. What happened when you went to Ghana?" And they'll tell me
Right.
that story, or that their kids are, going to go away to college, or they're going on a family cruise, or uh, they and their husband are having some big anniversary. So it's catching up on all that
Yes.
and spending time. And so I enjoy that. And I think that's the part about retirement that is going to be difficult.
Yes.
But I have thought about there's a nice community garden here, and they're very active at that garden. And I don't know if you heard about this, but there was a psychiatrist in Zimbabwe. He said they don't have enough psychiatrists there. So what he did, he decided to start educating grandmothers. So they have what they call the talking bench.
I did hear about this.
Yes.
Yes,
So I
yes.
thought, well, if I'm not going to practice, just so I don't have to keep up all the malpractice and other things, I'll just have people, they'll have an understanding. I'm not giving professional help, but I'll have the talking bench. And I can go down certain days of the weeks and time, and people can sign up if they just want someone to listen to them or just want to talk. And
Awesome.
so I figure I'll do that, and I'll still be visiting with people, but giving them maybe a little guidance and yeah. So I've thought that I'm looking into that.
That's brilliant. And it moves me so to hear that, because you literally, you're finding your way as you go through your life. How do you serve the community that you live in? How do you reach into that community and stand strongly and solidly with them? And
Mhm,
even in retirement, you have a plan.
mhm.
That is
I
midwifery
was
as
looking
far as
for a
I'm
plan.
concerned.
I was looking for a plan because, if you've worked all your life, um, it,
Yes,
just to say, oh, I'm not working. So many people say, why are you still working? And I thought, like, when you have your own business and something you enjoy and you get up every morning for, it's not like a job. It's,
exactly.
so it's a whole different, plus, if I want to take off a week or go see my grandkids or whatever I want to do, I'm still able to do that.
That's right.
But, um, so I still have flexibility,
Well, I
but I
love
think
it.
that's what I'm looking at is doing something like that. And you know what? I'll also see men and teenagers, and if kids want to come talk to me, I'll talk to them too.
I bet
So,
they will. I bet
yeah.
they will. I think
Mhm,
this is the part that we can share back our stories, share back our learnings, share back
mhm,
our
mhm,
pain even, and be heard as well in turn. I
mhm.
think, when I named the podcast, I came up with this idea that I wanted to call it the perinatal pause,
Oh,
because
yeah.
as much work as we do, have done, and continue, to do, um,
Mhm,
we must stop a minute. We must take a break here. We must take a little minute for reflection. And this
mhm,
pause, as we can incorporate that, I think that will help all of us as we, move through our final years.
mhm,
If you
mhm,
have a blessing, a prayer, piece of wisdom for these junior midwives coming up, so that they can, go forward and come through and live a full life, just like you've just described
mhm,
today, what would you
mhm.
say? What would you want to share?
Well, it's very important to have supportive family members. And, thank God I've had a husband that was supportive. So when I did want to go back to school, he was right there, helping when the kids were young. I mean, he could dress them, he'd try to braid their hair. And but that was something I saw in my parents, that
Yes,
they worked as a team. And so I would say if you have someone in your life, you know, make sure that you get a supportive person. Now, I had someone when I was going through midwifery school, about 6 months before I graduated. There was a professor. She didn't last long, but she was out here at the university in the School of Nursing. And when she found out I was going to be a midwife, she said, "Well, those folks always end up getting divorces. That you're going to be divorced in a few years, if you're going to do that." She says, "All the midwives I know get divorced." And I thought to myself, that was a cruel thing to say. But but I think if you have someone, well, I know in my case,
yes.
my husband was always supportive. We worked as a team. Uh, he could get the kids together just like I could get them together. Um, if he had to throw in some laundry, drive the kids, whatever, we worked together, whatever we decided to do. And then when I said I wanted to have the office, He helped me with that. Um, so, it's important to work as a team.
Absolutely.
So I would say have people in your life that back you. If you have someone that you don't think they're 100% behind you, especially when you're in school, don't tell people your dreams, the type of folks that are always going to tell you why you can't do something
That's
or
right.
put a damper. Don't even share it with them.
Mm-hmm.
Yeah, don't share it
Right.
with people that can't be supportive because they don't help move you forward. But also taking some time for yourself, you have to pace yourself. So if I knew I
Right.
had a lot of women coming up due, I'd come home from the office and maybe I would just relax or read a book. I wouldn't try to get a lot done, maybe tidy up a little bit, but
Mm-hmm.
I don't try to do 100 things. Or I say to my husband, look, you know what, you take the kids to things they have to go to. I'm just going to rest here. So pacing yourself is very
Definitely.
important
Definitely.
because you can get run ragged and then you're no help for anyone when that
Exactly.
happens. Mhm.
Exactly. I think we have a lot of work to do to learn how to take care of ourselves and center ourselves in order
Mhm.
to be able to continue to center families and
Mhm.
community.
Mhm.
So,
Yeah.
Martha, bless you. Thank you so much.
Well, thank you for having
Beloved
me.
elder. I'm so
Yeah, thank
glad you
you
were
for
able to
having
join.
me.
Yeah, it was wonderful. I mean,
Yeah.
I just, pray that your hands and your heart and your
Mhm.
history continue to guide us and you've shared
Mhm.
so generously with us today. And so thank you for getting on our podcast. This is a
Oh,
moment
thank
we
you.
take together to make sure we remember and we rest a little, we reclaim our
Mhm.
power and this is the hands that caught us. So
Mhm.
thank you.
Mhm. Thank you so much.